Hashtag end this together. It's the new coronavirus mantra. People are cheering for healthcare workers, singing from their balconies, and painting rainbows on their windows. It gets you all right in the feels, doesn't it? But at the same time, I'm seeing story after story about hate crimes against Asian Americans and Black people dying from COVID-related causes at alarming rates. So I gotta ask, if we're really all in this together, why is the coronavirus pandemic hitting people of color so hard? The numbers are scary. According to the CDC, in the US, Black people make up 30% of all COVID-19 cases, but only make up 13% of the total population. The Associated Press took a look at who was dying, and they found similar numbers. 1/3 of COVID-19 related deaths were Black people. The data we have isn't complete. In over half these reported cases, racial data is missing. But when we look at the states and cities that do have that info, there's a similar pattern. In New York City, where the virus has hit the hardest, you can see that African Americans and Latinos are dying up to twice as much as white people and Asian people. I checked in with PBS NewsHour student reporting labs to see what they thought about all this, and they definitely wanted to dig into the issue.
There's also that hidden inequity of different races not getting the same medical treatment because of implicit bias and other barriers such as cost that keep Black and brown communities from getting adequate healthcare treatment.
I was also wondering how the trust that certain communities have in the federal government translates to how much they would actually be willing to go to a hospital and follow social distancing procedures and all the government measures.
Is it based off of race or is it based off of accessibility to being tested for the corona?
Okay, newsflash, I'm Black. Shocker, yes, I know. And to figure out why COVID is taking such a deadly toll on my community and communities like mine, I decided to talk with, well, you know what? I'm gonna let him introduce himself.
My name is Kamau Bell. I'm a comedian and executive producer and host of the Emmy Award-winning, the 3-time Emmy Award-winning CNN series, United Shades of America.
Let them know. A great show.
I'll bring the Emmys if you need me to prove them. They're out in the other room, but I'll bring them if you need me to prove them.
We believe you, but you
Okay,
can flex. You can flex if you want.
Kamau has spent a lot of time visiting different communities all over the US to better understand the challenges they face. So he seemed like the perfect person to talk to about how the coronavirus intersects with race.
I think if you turn on the news, a lot of times they're just sort of like, why is this happening? Why is this happening? It's a one-word answer, kids. And I don't mean that in a condescending way. I'm saying kids to even the adults out there, racism. Ta-da! It's the simplest answer is usually the best answer. I think you learn that in school at some point.
What Kamau is talking about specifically is structural racism. That's when a society is designed in a way that reinforces and perpetuates discrimination against certain races. In the US, that means people of color. So, how does all that relate to COVID-19? Well, researchers have known from the start of the pandemic that people with pre-existing health conditions, stuff like asthma or diabetes, are at a higher risk of dying from the virus. And Black people suffer from these conditions at high rates.
It doesn't mean we're predisposed to it. It doesn't mean we're not born into COVID-19. We're having it thrust upon us. We live in neighborhoods that are food deserts, that don't have healthy food. A lot of times don't have grocery stores. We don't make as much money as white folks. We don't hold as much wealth. All these things mean you have less access to good health and less access to health care.
These structural inequalities can create a situation where Black and brown people don't believe they'll get fair treatment.
Well, they've done all this research that says that when Black people go to the doctor and complain about our pain levels, the doctors judge our pain levels to be less than a white person complaining about the same level of pain. So even if you go to the doctor and go, oh, it feels like a 9, as a Black person, they go, I think you said 6. You don't know what a 9 feels like.
My mom is in the other room and just let out a loud, mm-hmm. So I wanted you to.
What's up, Mom? I'm glad.
So.
I'm big with the moms. I know how to speak that language.
Unfortunately, the structural racism doesn't stop there. People of color make up a huge percentage of frontline, essential workers, which puts them at a greater risk of catching COVID-19. They can't work from home. They're checkout clerks at grocery stores, bus drivers in densely populated cities. And if you're getting food from a delivery service, there's a good chance that that person is Black or brown too.
Everybody who's delivering groceries to my house is a Black or brown person. So therefore they haven't seen one mask. So a lot of us are on the front lines of this essential work, but we're not being paid or taken care for as if we're essential workers.
Lack of health insurance is a big problem. A 2015 report from Kaiser says everything you need to know. The access barriers facing uninsured people mean they are less likely to receive preventative care, are more likely to be hospitalized for conditions that could have been prevented, and are more likely to die in the hospital than those with insurance. Now, not all racism is structural. It can be blatant and right up in your face. As I'm sure you know, COVID-19 originated in China. That created an opening for racism and xenophobia directed at anyone who looks Asian, blaming them for the spreading of the disease.
Some of the subtle racism that against Asian Americans that may have happened before is just kind of coming out in like the worst ways.
My mom has this like scare mentality now of letting me step outside of the house.
When the virus started surging in March, the FBI issued this warning. Hate crime incidents against Asian Americans likely will surge across the United States due to the spread of coronavirus disease. And unfortunately, they were right. Complaints are coming in from all over the country, ranging from verbal attacks to physical assaults. So, this all leads me back to my original question. Are we really all in this together?
No, I prefer the phrase, it's on us. We're not in this together, but it is on us to get out of it. If we all come together and go, how do we make this system more just, equitable, and anti-racist, then this is the opportunity to do that, because COVID-19 is hurting us because it's not a just system.
So eventually we're gonna have to find a vaccine and hopefully learn some lessons from all of this. But structural racism ain't going away anytime soon. So what can we as a country do to actively fight against racism, whatever form it takes? How can we make sure that when the next pandemic comes around, we really are #in this together? Remember, it's on us if we want to make it happen. And don't forget to watch our other COVID-related content, and make sure to check out the PBS NewsHour Student Reporting Lab's YouTube channel to see student journalism from all around the country. Until next time, I'm your host, Miles Best. Peace out.